Foley. I'm the Director of Special Projects at Health Resources in Action. And on behalf of the Center for the Community Health Training Institute, we're going to be presenting this webinar on collective impact. And so welcome and thank you for joining us. I'm going to run through some logistics and then introduce Steve Ridini, who is our presenter today, in just a minute. The webinar will be ending at 1:15, and we have some information on the screen now if you'd like to join our email list if you're not already a part of it. You can get periodic newsletters and updates on upcoming trainings. The new calendar will be out at the end of July, and we hope to have you back to other webinars and in-person trainings in the next fiscal year. So for this webinar, we're going to be doing some polling during the course of the webinar. But during the webinar, if you have questions you'd like to ask the presenter right now, everybody's in listen-only mode. Please type them into your question box on the right-hand side of the screen. I will be sharing those questions with Steve either during the course of the webinar or saving some of them for the end time. And for the poll, all you have to do, there will be several options on the screen. There's 3 poll questions, and you can select yours, and you'll be able to see the tabulations of everybody's answers at the end of the poll. Excuse me. So, with no further ado, I'm going to introduce Steve Ridini, who is the Vice President at Health Resources in Action. Steve has been with Health Resources in Action for over 20 years and has lots of experience working in community health and doing a lot of work with coalitions throughout Massachusetts and across the nation. So Steve, I'm going to ask that you tell us a little bit about collective impact.
Sure. Well, thank you, Judy. It's a real pleasure to be here talking with you today and talking to folks on this webinar, and look forward to an interactive conversation. So as Judy and I and Stephanie, thank you also for helping with your support on putting together this webinar. As the 3 of us were thinking about this idea of collective impact, I guess I'd like to frame my comments into, so why now? Why are we thinking about collective impact and the importance of collective impact? What is it? And by now, probably most of the folks on the call today have an understanding of collective impact, but I don't want to take that for granted, so I want to just make sure we're all on the same page about the language and the frame of collective impact. And then some thoughts from our experiences about moving forward. So where do we think collective impact is going? And I would love to share with you our thinking based on our practice and our research in this area and some of the things that we're funding, and then to open it up for conversation. So as we begin thinking about this, I'd like to go to the first slide and kind of just have a context of, so why now? Why are we talking about this idea of collective impact, and why has it taken off? And as you see the slide in front of you, the PowerPoint slide, many of you are aware that there are multiple factors that influence health status. And this is not something that's new. It's been in discussions for years from work from the Centers for Disease Control and Prevention. This latest slide is an adaptation of the County Health Rankings slide from the Democracy Collaborative out of Baltimore. And if you look at the slide, it's basically telling us that a significant portion of our health status is influenced by factors related to the social determinants of health, such as social and economic factors around education, employment, income, family and support systems, and community safety, followed by healthy behaviors in terms of looking at behaviors or health style choices that lead to health. So, and then the physical environment being about 10%. So when you add those up, we're talking about anywhere from 70 to 80% of the factors that influence our health status are outside of the medical care community and the quality of care that's given to us. Again, those aspects of the work in terms of healthcare are very important. However, when we look at the research, there are other things that are influencing health. So as we think about this, or as I've started my journey in this work in public health years ago, we tended to think of kind of working with the traditional players in kind of a public health sphere. when you look at this type of information, it really creates an opportunity to engage a whole host of folks in terms of thinking about improving population health or improving population health status. So when you go to the next slide and you begin to think about having an impact and thinking about change and whatever change you're interested in looking at, what levels of change you're interested in operating at, and the level of impact, we kind of took a look at Tom Frieden's health impact pyramid and began to look at how we think about change at the different levels. So what this pyramid tells us is that you have an opportunity to operate at multiple points of this pyramid, from counseling and education all the way down to kind of changing the context or the norms within a community to the socioeconomic factors, which are, we believe, the root causes for many of the health issues, the health disparity issues we're dealing with. And when you think about change, at the top of the pyramid, we're really looking at models that relate to individual change. And as we go down the pyramid, we're thinking about community-level change. So if we think about the previous slide in terms of what's influencing health status, if we think about this pyramid in terms of community-level change, what this tells us very simply is that it's not just one individual or one entity that's going to be able to address these complex issues. And my hunch is many of us on this call today realize that and are cognizant of that and are doing work in this area. And so what's exciting today is to be able to talk about, as we think about this next slide, if we really want to see this area of community transformation, there are certain things or elements we need to think about in terms of what types of partnerships or collectives or collaboratives we're working on, what kind of approaches we're using, whether they're evidence-based approaches, whether they're innovative approaches, if they are programmatic, if they're policy or systems-driven, what type of impact we want to see within the organizations we're working in or the broader community or the populations we're working with, and how do we want to sustain this change over time. And for us, sustainability is, in addition to funding, it may also be in-kind support, but it also could be the type of work you're working on as it relates to the pyramid in terms of policy change versus programmatic change. So as we think about all these different elements, there's an opportunity to kind of engage us in this conversation of collective impact as to where we're at today and where we're going in the future. And so the next slide is really, if you go one back, thanks so much. If you look at this slide, when we think about this idea of collective impact, if we look at the left side, what we typically are finding as we're doing community health work in community is that there tends to be a lack of coordination of efforts. There tend to be multiple goals and measures. There tends to be a lack of communication and disconnected action. And so what you have here in this picture is kind of a lot of arrows moving upwards and moving in a particular direction. But what this tells us is there's an opportunity to really align efforts to be more effective and more impactful. So when you think about this idea of collective impact, there's an opportunity for cross-sector work to be aligned, to think about uniform goals and measures and uniform data, that our change approach is really building upon aligned strategies, whether they be programmatic or policy, to reinforce those approaches, and that there's coordinated action and communication. And so when we think about this idea of collective impact, there's an opportunity in this next slide that these are the 5 elements that Kramer and Kanya talk about through their work through collective impact, where they basically say for the foundation of effective collective impact work includes these 5 areas. So one is a common agenda, so that the folks that are coming together to work on a particular issue have a common understanding of what the issue or the problem is, and they have a shared agenda or vision for change. The second piece is that there's a shared measurement, that we're beginning to look at how we gather data, both quantitative and qualitative data, and measure results, and that there's some level of shared accountability in terms of that data gathering, data interpretation, and then moving forward with how we want to think about impact. The mutually reinforcing activities or approaches or strategies are an opportunity to look at what kind of either evidence-based or evidence-informed or innovative approaches we may be able to apply to the current situation in terms of how folks are thinking about that situation, whether it's a city, a municipality, a state, a county, but to think about what types of mutually reinforcing activities or strategies we may be able to put in place that's based on the data to address the issues to get us to the common agenda. Throughout this process, it's important to have clear and open and honest communication. That also means we need to have clear decision-making processes, an understanding of conflict and conflict management, and really building upon either the trust that's there or building a sense of trust through relationship building that will allow all the various partners to come together to work on this information. Another thing that we typically find in this area is that when you're bringing together multi-sector partners, it's important to be on the same page about what kind of language we're using to think about, because there are opportunities and there are acronyms and there are ways that we think about this work that tend to silo ourselves, and I don't think that's the intention. And when we're bringing together multi-sector partners, probably a great place to start is to begin thinking about where the commonalities are about the work and how we think about our language. And then finally, Kanya and Kramer talk about backbone support, and their idea that whether it's a separate organization, some people may interpret this as creating a nonprofit. I'm not sure I necessarily think about that we need to create new nonprofits, at least in the state of Massachusetts. It may be finding a nonprofit that is currently doing this work or that has the capacity and the will to become the backbone support. The key piece here, though, is that we've got dedicated staff who have the resources and the skills to bring together folks to lead a collective impact process and to convene and to coordinate efforts and to kind of keep momentum moving in a forward direction. So whether that's a new nonprofit or building on an existing infrastructure, it's important to have the dedicated staff that can be the neutral bodies and the conveners to bring together this work. So if that's the basis of our work around collective impact, what we wanted to put out there as a first question to you is, when you think about your efforts and think about one effort you're currently working on, how would you describe your efforts? Do you see it as simply networking? Do you see your effort as collaboration with shared effort and leverage funding? Do you see it as organizing collective impact across with dedicated staff to the task outlined by the work? Or is it something else? So let's give you a minute to kind of answer that question. So let's see what we get.
So this is your opportunity to weigh in the poll. You can select your choice, and I'll close the poll when we have a majority of folks voting. I heard recently, Steve, at one of the conferences that a funder who was presenting mentioned that almost all their applications said that people were doing collective impact presently.
Oh, interesting. Interesting.
But I think that most people are doing collaborative work. That's my guess.
Well, and if we look at some of the data that's coming in, this would support that. And I really appreciate where people are at in terms of their responses. So let's see if there's anyone else before we close the poll.
Okay, we've got a good majority. I'm going to close the poll and share the results so you can see. So we have about 16% of the people on the webinar said that they're doing mostly networking. Mm-hmm. Around 46% said that they're collaborating with shared effort and leveraging funding, and 36% said that they're really doing collective impact with dedicated staff and shared measurement and so forth.
So what this is telling us is just under half of the respondents are working on collaboration with shared efforts and leveraging funding, which is incredible. And then a little over a third are beginning to organize around collective impact. So we've got a very sophisticated group of callers who are participating in on this call today. And I guess what I just want to emphasize here is that there's no right or wrong answer to this. The real important piece is to know where you're at, whether it's under networking or collaboration or collective impact. I would say maybe 10 or 15 years ago, if we asked this question, we'd probably be more in the area of networking and just beginning to explore collaboration. And we've seen where the field has come. I'm working currently with a group right now that knows all about collective impact, but has decided to be a network and continue to be a network. And there's nothing wrong with that. I think the real importance is to make sure that the partners around the table are all in agreement about where you're at in the spectrum. And so what this data is telling us is we've got a group of participants that have moved towards collaboration, and another group that are even taking collaboration to another level in terms of beginning to think about collective impact, which I think is incredible. So thank you all for sharing that information. What I wanted to do now is just talk briefly about kind of Kanye and Kramer's kind of first piece in terms of the common agenda. So we feel like this is really important to kind of talk about when we think about a collective impact approach, because this is the piece, this is the shared value, this is the shared purpose of this work. And so when we begin to think about bringing together multi-sector partners together, we're well aware that people have multiple agendas, and there's nothing wrong with that. What's really important, though, is we begin to think about our collaborative and collective impact work. We need to think about how those agendas morph into a commonality or shared purpose or shared vision. So I won't read through all of these, but when we think about kind of a healthy communities work, there's an opportunity to think about a vision that broadly defines health, that is built on community values, that engages and respects diverse community participation and ownership, that invests in youth leadership and development, that focuses on systems change in addition to maybe programmatic work, that builds capacity using local assets and resources, and that begins to think about benchmarking and measuring progress and outcomes. So for you all, I guess the takeaway here is to really engage you in part of this as you think about this collaborative and collective work, is to really think about the opportunity to do some visioning with your partners and to see where you're all at. Because what the research tells us is that if you have a strong sense of vision, you know where you're going, there's a greater likelihood that the collective effort will move towards what they're interested in achieving if we have a sense of shared purpose. And so as we move to the next slide, this is a simple case study of some work that's currently happening here in Massachusetts, where we have an opportunity to move the needle on a vision around looking at making tobacco history. So for folks who aren't from this state, we have a youth movement that has been funded by our State Department of Public Health for probably the last 7 or 8 years that is called the 84 Movement. And this is a place where there has been a common vision and agenda that's been created by the funders, by the backbone support organizations, and the very youth that are engaged in this process. And as we think about this vision of reducing tobacco use among young people and adolescents, we have looked at some reinforcing strategies related to policy and systems change. So to work with these local advocates in these sites across the state, as you look at the lower left picture, we have over 100 chapters of school-based and community-based 84 chapters that are doing work to advance policy and systems change within their schools or within their broader communities around tobacco use. And what's exciting about this work is that in addition to the policy piece, there's a programmatic element and a communications campaign that has allowed us to move from 84% of the population in this state, the youth population that doesn't smoke, to now where we can actually say 89% of the young people in the state of Massachusetts, 89% of adolescents are not smoking. So in this period of time and in this investment of resources, we have been able to achieve a vision of seeing a larger number of young people choose not to smoke, which is very exciting. And interestingly enough, when we think about the backbone support through resources from our state government, we as an organization, as HRiA, have been able to work with the local schools and community-based organizations as backbone support entities to drive this agenda at the local level. As we think about the next slide, in terms of multi-sector partnerships, I just wanted to make sure that we're all on the same page, that we think about how we value the idea of multi-sector partners, because multi-sector partners can be challenging. both in terms of that may not be a history of working together. We may be using different language. We may be using different measurement systems. We probably have different approaches to our work. And yet we also know that if we go back to Tom Friedman's pyramid, or if we go back to what really influences health status, we need to think about partnerships and collectives to move this agenda. So when we think about the value of this work, that in addition to some of the challenges we face, that partnerships really encourage collaborative problem solving. There's an opportunity to bring both the providers and the consumers and or the clients to the table to address new and broader issues. We have an opportunity to address issues from a creative, culturally relevant solution to issues. We can maximize approaches and minimize duplication of efforts. And we have the ability to leverage additional resources. Again, this goes back to the idea that no one individual or entity really is going to be able to solve these complex problems alone. We really need to think about working collectively. So when we think about this idea of partnership, there's an opportunity on this next slide to begin to dream who is in your partnership. So this is one tool that we use that is available on our website, and we can also send to you following this webinar, that begins to create a space for you and your initial partners to begin thinking, so who do we need to involve in this work, whether it's schools or the businesses, the faith community, healthcare, immigrants and refugees, young people, parents, economic development, parks and recreation, policy lawmakers. So this is a sample of a partnership wheel that we began to develop in Austin, Texas. The bottom quadrant on the right-hand side is the rest of the sectors they engaged, which we identified 64 sectors in that city that would be involved in a community health improvement effort. So we leave this open for you to kind of determine what those sectors are and how to engage them in the process. The next slide is another tool that you could use to begin to identify who those partners are and how you want to engage them in the process. I won't go into details into this slide. It's very self-explanatory in terms of thinking about who you want to use, what sector they represent, how deep they're already engaged, and what potential levels of engagement you would like to use in the future. The next slide begins to also think about, once you have people to the table, how are you engaging them? And the belief system is that if you've done a good job of recruiting and you are interested in high levels of retention, we really need to think about engagement. So the piece here is that as we build these multi-sector partners, it's important to realize that there will be a core circle or a core group of people that will be engaged in this work throughout the process. And then you have opportunities of concentric circles of engaging other folks who may be part of working groups under the circles of engagement. There may be circles of champions who may not necessarily be part of the process, but may be the folks that have access to resources and the political will to move your agenda. There may be another group of folks that are interested in receiving information, and you can build their awareness around these efforts through emails and blogs, but they may not participate in your meeting, but you can call on them. And then there's a group of folks that may be your circle of possibility or potential that may not be involved in any of these efforts, but you're thinking about how to engage them at some point in the future. And the key here with the circles of engagement is to really think about where people fall into these circles and know that people will move up those circles and down those circles, and that this is a fluid process. And that it is important to have a core group, but that core group may not be the same core group that you have a year or 2 years from now. Some of those folks may drop off, or they may move up into those circles, and then other people who are at the higher realms of those circles may move down into the core group. And it's important for us to begin thinking about how are we engaging folks intentionally through this process. And so if we go to the next slide, there's another opportunity to think about another community in San Antonio that also is working on a collective impact approach through their community health needs assessment and the community health improvement planning process. So San Antonio happens to be the 7th largest city in the country. They have, over the years, have brought together all of their local hospitals, their health department at the city level and the county level. They've brought together their funders, the United Way, their community foundations. They've brought together providers and community members to basically build a vision in San Antonio that's about building healthier communities to improve health for everyone in the community. And so when we think about that, it's a very broad umbrella that many folks can fit under. They have community development corporations that are involved in this effort. They have the local school systems involved. They have the local library system involved in very creative ways. They've got other forms of municipal government involved in supporting this agenda. And as we think about this work, their approach is how they're really thinking about inspiring individuals and families to think about behavior change, kind of at an individual level and a familial level, but they're also looking at how we can improve access and availability of healthy options under their approaches. Their strategies, which they've begun to align into kind of 3 buckets, are how do we influence behavior change around policy and systems work and program work? How do we promote systems and environmental change? And then how do we leverage additional community resources to move this agenda? And they have a set of outcomes that are related to these 5 priority areas around healthy eating and active living, healthy child and family development, safe communities, behavioral and mental health well-being, and healthy sexuality. And these entities that come together as funders have also funded a backbone support entity called the Health Collaborative of Bexar County that really takes this information and these approaches through this plan, and they are the key ones responsible for implementing the efforts of this plan. So you've got a vision, you've got mutually reinforcing strategies or approaches based on data, you've got a backbone organization, and that backbone organization is the place where these multi-sector partners are coming to in San Antonio to work through these issues on a daily basis. So as we think about this work and all the good things that Kramer and Kanya have been able to share with us around collective impact, at HRiA we also want to take collective impact to the next level in terms of thinking about, so we've got collective impact, and if we really are thinking about where we want to go with collective impact, we think it's around this idea of community transformation and really thinking about a shift in power, a shift in how communities operate today in terms of how they think about race, how they think about economics, to really transforming communities to be fully engaged in the process of leading towards improved health status for all populations within a community. So some things that we would probably add to the mix or the discussion are really these 4 buckets around engagement, equity, leadership opportunities, and resource diversity. And so when we think about this idea of civic engagement, in addition to thinking about creating a shared agenda or vision, our questions are, who are we engaging in this process? Why are we engaging those folks? Do those folks represent and reflect the communities in which we are working? Do they reflect and represent the individuals we want to be actively engaged in the change process? And so it's not just about the providers, it's not just about the funders, but it's actually engaging community members across the age span from youth to adults to elders in these health improvement planning processes. And then how are we intentionally engaging, mobilizing, and retaining these individuals across the community into these efforts that will achieve collective impact and move towards transformation? Another lens that we'd like to think about this work under is equity. And as we think about this collective group of coming together, what is their vision for an equitable community? How are they defining equity? How are they thinking about community? Is an equity approach integrated across all aspects of their work? And how are they doing that? So front and foremost, there needs to be conversations around equity. Obviously, equity will also hopefully lead to discussions as to why we're thinking about equity from looking at the data that may be a place of disparity. But as we think about equity, how do we envision a future where everyone has access to the resources to realize their fullest potential? And so we feel like this is an important aspect of this work. And then under leadership opportunities, which is really exciting, we get a chance to think about how is the community actively engaged in leadership? How are we building leadership capacity? Who are the champions, and do they have access to the resources? And do these champions have access to resources and influence to move our agenda? In a minute, I'll talk about how Kanya has taken leadership opportunities to the next level. And then in resource diversity, again, we think not only is it important to be thinking about mutually reinforcing strategies and approaches to sustain the work, we need to think about how you're sustaining this effort beyond programming and thinking about resources and in-kind support and sustainability planning to kind of move the agenda forward. I think sometimes we get caught up in doing assessment and planning and then get into implementation, and then we begin to think about evaluation and sustainability. So our thinking around this is how do we begin to think about sustainability and evaluation from the very beginning. And then as we think about this idea of leadership, another piece that FSG has put out that is a really nice piece is beginning to think about systems leaders. And they're talking about this work from an ecosystem point of view. And if we're really thinking about collective impact and transformation, we need to also be thinking about a different type of leader who has the vision for this work, but also has the capabilities and capacities to think about the larger system or systems, to be able to foster reflection and more generative conversations that build trust and collective creativity, and that leaders work very much with the other providers and community members to co-create a future that everyone believes, in and can support health status and a sense of health equity for everyone engaged in the process.
So I had a question, Steve, from one of the audience members. They're asking, with this large number of people involved,
yes,
and continuing to engage new members,
yes,
what do some of the structures look like? Not everybody can have an equal vote in this.
Right. That's a great question. And what I would say is we're happy to share some information with you. Typically, what we find in terms of a structure is that there are a variety of models out there. One of the models that we tend to support is one that has a core group of folks, kind of going back to the circle diagram, where you've got a core group of people that may represent kind of a steering committee or so, or a leadership team. And that could be from anywhere to 8 to 10 members. That steering committee is made up of folks from the community. It's made up of providers. It's made up of funders. So they're a mix of people. Notice I'm talking about providers, funders, and community members, Judy, because it's important to have all of those members engaged in this process. That group is usually staffed by one of those people that we were talking about earlier from a backbone organization that could play the role of convener, facilitator, to move that group forward. That group, as a leadership body, then typically oversees a series of working groups. And you can think of this as kind of the spokes on a wheel in terms of a cyclical style. You could see it as a hierarchical style. Whichever one you choose, we tend to think of it more cyclically, where if you have the core group in the middle with that dedicated staff providing that backbone support and that institution providing the backbone support, you have a series of circles that follow that core group that make up the working groups that may be related to program, that may be related to communication, that may be related to policy, that may be related to marketing, that may be related to funding or sustainability. And those groups are made up of an additional grouping of people from the community that are interested in getting the work done in the smaller working groups. That information, that work is happening there, and it kind of is then shared with the working group. And then what we have typically found is beyond those smaller working groups, there may be even a larger body of people that are coming together once or twice or 3 times a year that represent a larger number of people in the community who support this work as champions, may not be involved in the day-to-day or month-to-month work, but are very much actively involved in this process. So I hope that kind of paints a picture of one way to think about organizing this. The key piece is that there is some kind of a structure, that people are clear about what their roles and responsibilities are within this structure, and you've got people dedicated to serving in these different groupings, and that you've got someone or somebody that are the dedicated people that move this agenda forward in each of these areas, and that all of these groups are communicating with each other. So one piece that Judy's reminding me of is that when we think about these concentric circles, is that members of the leadership team or steering committee would also serve on these working groups, who may also serve in the larger group, because you have to have levels of communication happening at all areas so that people are connected and not only know their roles and responsibilities, but are able to get information up and down or across these various working bodies within this entity.
And I would say that the communication piece is really key.
Absolutely.
For building trust, to keep everybody moving in the same direction, for taking a look at measurements,
absolutely,
tracking data, and sharing that, making sure that things are moving in the direction that you want.
We typically say in this kind of collective work, it's important to have communication, it's important to have cooperation, it's important to have coordination. So when you think of this, these 3 C's around communication, cooperation, and coordination, those are all key fundamental aspects of this collective work. So thank you for that question. I hope I answered it for you.
Great, thanks, Steve.
So as we go to the next piece in terms of moving from the system leaders, we had a second question we wanted to ask you all. And we feel like we put out some of these answers because these are barriers we face in this collective work. We wanted to ask you, what are the biggest barriers to collective impact? And then give you a chance to choose as many of these as apply. Is it time, money, staffing, a willingness to share power and credit, concerns about measurement and outcomes? So we'll give you a minute to fill that out.
Thanks, Steve. I think that, again, the concept of collective impact is relatively new in our language. I mean, it was really coined by Kanye and Kramer in 2011. I think we're learning more and more about it, and I would also assume from all the work that's being done on CHAWS and CHIPS lately, the community health assessments and community health improvement planning, that measurement is going to be the next biggest challenge.
Absolutely, absolutely. The beauty of their work is that I think it resonates with so many of us doing this work. I think many of us who've been in the field for a while will say, well, this is not anything new. In fact, it builds on the healthy communities work that's been happening around the country. It builds on the community development or community organizing work around the country. What I love what they've done is they've added a whole element about thinking about aligning resources and thinking about shared measurement systems. So as we think about what they've contributed to the field, it's taking the work that the good work many of us have been doing and creating a level of credibility in the sense of giving us some data points around qualitative and quantitative data points to help us think about, are we achieving impact? And that's the beauty of this.
Great. So I'm going to close the poll now and be able to share that with the audience. So it looks like some of the barriers that folks voted on were around 19% said time.
Yep, no surprise.
That's a challenge, yep.
Yep.
9% said money might be a barrier.
That's a surprise. I usually find that's higher, so we must have a group rich with resources on the call. That's good.
28% said staffing was a challenge.
Yeah.
And 30% said the idea that, you know, you'd have to share power and credit.
Yes.
And then 14% were concerned about measurement.
So let's take this for a minute because I actually think these answers reflect some very sophisticated folks on the call. When you look at option C and D, that's where the majority of the answers are. Again, taking away from time, which is a little bit less, but it really is about staffing. And my hunch is, and I'd love to hear if there's a particular question around this, the staffing may be the dedicated staffing we're talking about. It may be staffing about the skill sets that you need to move this kind of agenda in terms of collective impact. So I'd love to hear about that if people have some more specificity there. D, the willingness to share power and credit. This is something we're finding across the boards. So we're really encouraging folks to come together to work collectively. And yet what we're finding is that some of the institutions we're working with, and I'm thinking about ourselves, Judi, and some of the folks we're interested in working with, there's sometimes a real reticence to be interested in sharing power and credit. So from the outset, I think those conversations need to be had with players in terms of what's the model here. And I'm not going to get into what's right or wrong, but I think having very honest and authentic conversations up front about, so what's the vision for this work, and how are we thinking about power and power dynamics? How are we thinking about sharing the spotlight? Because I'll tell you, these days, community members can sniff this up pretty quickly. I also find providers can sniff this up quickly about who's at the table and who's got a history of either collaboration or who doesn't. And so these are things to really sort out from the beginning in terms of asking folks. And again, I'm not saying it's right or wrong. It's more of a question of there's an opportunity to begin thinking about, are people interested in this? If we want to move towards collective impact, and if we want to see community transformation, I'll tell you right now, we need to think about our willingness to share power and the spotlight. This is not going to work if we're not doing that.
Right. And I think your question up front on the other slide about equity raises those issues.
Absolutely.
This is going to be the kind of vision that you want everybody's input and equal decision-making power and shared measurement and authentic engagement. And you really have to raise the issue of equity.
Exactly. And or be transparent about where you're at in the process. And I think people will understand that. I think transparency and communication that you mentioned before is so critical to this. And if we're really talking about authentic engagement, and this is where we get into this issue when we bring community members into the fold, is that are we really interested in true authentic community engagement in these processes? And if we are, great. If we are, it probably also will mean what are we going to have to do differently, or how does that engagement inform or change how we do business? If you're not, I would suggest then don't go down that road, because it's going to just get sticky and messy.
Great.
So thank you, folks, for answering those questions. That question, it was really helpful. And then finally, I just wanted to share one other case study and then really open it up for conversation. This is a case study where we at HRiA had a chance to work in a small community in Windham County, Vermont, in Townsend, Vermont, where we worked with a funder through Bank of America, where a family trust was set up. And this is an example of catalytic philanthropy, but it also brings home the point of collective impact. So we've been there since 2000. Doing work in this particular community or set of communities that has a combined population. These 12 communities have a combined population of about 26,000 people. The resources from this trust, there's a trust that is now in that community valued at about $32 million. The interest off that trust goes into the community each year to meet the medical and health needs of the community residents. And what was really exciting about this process is that as we gathered data over the span of a year through a community health assessment to look at what the needs were and what the assets are in this rural part of the country, we began to develop a set of priorities that were developed with providers and community members that allowed us to think about how we might move the needle on improving population health in this part of the state of Vermont. What clearly came out of this discussion was the issue of elder health and an aging population in this county, or actually in Vermont, but in this county in particular. And at the same time, we had an issue with a hospital that was closing a nursing home facility, which meant that folks who had lived for generations in this particular area would have to be moved across the river into New Hampshire to a nearby nursing home facility. So going through a process that was encouraged by the hospital and encouraged by the funder through their catalytic philanthropic approaches, there was a vision that the community created, basically a group of elders in the community created about wanting to age in place in this community. And I remember thinking, as one who was kind of co-facilitating this process, what a wonderful vision, and how the heck are we going to get there in terms of the resources. And we began to think about what this vision looked like and began to build a core group of folks that had this vision and brought other champions into the fold. We began to look at models around the country in terms of what aging in place looked like successfully. We looked at data. We looked at approaches to this work. We built a backbone organization called Valley Cares, which became a 501c3. And this picture up here is actually the vision of aging in place in Townsend, Vermont. So the brick building in the middle is the building of a farmer who lived contiguous to the 17-bed hospital, which is on the left side of this larger white building. Is a 17-bed hospital that has been serving that community, Grace Cottage Hospital, for years. And this farmer had a piece of property that was in his family for generations, contiguous to the hospital. So as we went through this process and began to look at what aging in place looked like, we had some very innovative folks from the hospital and from the community, basically, and community members envision a facility that was both assisted living, subsidized living, and market rate units. And so what you see on either side of this brick building are the 60 units of housing of assisted living, subsidized living, and market rate values for individuals who could age in place in this particular community. These were resources that were one of the groups that was able to kind of jumpstart this approach was Bank of America. They were also, through these resources, able to leverage additional state dollars and federal dollars, and looked at some models just outside Burlington that had a very similar approach. And through kind of a level of community engagement and visioning, and then working with the right folks around resources and looking at a market plan in terms of would this facility be viable in this area, there was a vision to and an ability to take those resources and create this space. And the beauty today, one of the unintended consequences of this work is the hospital, which happens to be next door to this building, is a place where the providers now just have to walk across a stream, a bridge and a stream, to get to this facility and provide a set of services to individuals who used to be scattered across a county. And if you can imagine Vermont in the wintertime, what that meant for providers, so that you've got a facility. The middle building, the brick building, is the 501c3, the backbone support. The outer buildings are the buildings that house elders. And talk is in the air that they're interested in expanding this facility for another 30 units.
That's terrific. But it has all the elements, both of collective impact and the other ideas that you were talking about, civic engagement, equity, right? Because
Absolutely.
It's not just for folks who are able or insured to have this kind of care, but it's for multiple levels of income.
Absolutely. And what this also has is that engagement piece, real engagement from authentic engagement from community members who had a vision of what they wanted to see in terms of aging in place. And leaders both from the healthcare institution, the foundation, the bank trust, and others who had done this work in other places willing to share this information. It didn't mean there weren't bumps in the road. It didn't mean that this took time. This took 5 to 6 years to actually get off the ground and actually have a groundbreaking ceremony. This process started years ago. So there was a vision, there was a commitment to a vision, and there was a perseverance of many stakeholders to achieve what they now have today. So this was messy, it was exciting, it was exhilarating. We were taking steps forward and backwards, and yet this is what folks were able to achieve in this community. And it really is a testament to the community members who wanted to see this vision through.
And a testament to collective impact really working on multiple measures.
Absolutely.
You increased access, you increased aging in place options for those folks in Vermont.
Absolutely.
You increased the community values and real estate values in that area. So how many other measures could they possibly want to have impacted it?
Absolutely. And I don't know if this is just rural lore, but that home in the middle, which was a farmer, I believe was donated to the hospital if he could be guaranteed one of those rooms in the facility in his later years, which is I think did happen. So so this is another kind of story of kind of collective impact and community transformation coming to life. So the last piece I just wanted to talk about was kind of learnings from the field before we get to our final polling question. And so when we think about this idea of collective impact leading to transformation and building on the good work of Kanya Kramer, and then thinking about an overlay of equity and an overlay of engagement and an overlay on leadership opportunities and resource planning, that it's important to pay attention to not only the vision, but the processes and the products. So what we're saying here is that you need to pay attention to your outcomes and your impact, but you also need to pay attention to the process by which you get this work done, how you're organized, how you're communicating, how people are engaged in this process. It is critical that you're looking at both of those things and that they're happening in parallel. Relationship building, building on either existing relationships or new relationships, and communication and trust, and managing conflict that may emerge through these processes is really important. Relationship building is a big part of this work. The importance of framing and communicating the message. Again, when you're bringing in together multi-sector partners, what the initial message may be, may change as new partners come to the table. And you've got to think about a message that is broad and that provides room for everyone kind of under that message. It's important to show progress, whether those are process measures or recognition events, and celebrating success. And again, this idea of recognizing the individuals and the agencies that are involved in this work. Too often we find that people are doing this and we forget to think about how we're recognizing individuals in this approach. If we could spend more time thinking about recognition, whatever that looks like, I think that will go a long way. Depending upon who you're talking to, it's important to articulate impact and return on investment, whether it's to a private philanthropic funder, whether it's to the government, whether it's to a group of stakeholders. We need to be thinking about, are we having an impact, and what does that impact look like, and what are the cost savings that we have. Infrastructure support, when we get back to this idea of the backbone organization and dedicated staffing, what we realize is people have multiple jobs and multiple responsibilities. It's really hard to just add this whole other piece on to someone's current work or job description. So we really think about and emphasize the idea that this takes dedicated staffing, it takes dedicated infrastructure to advance this work of collective impact. And then to think about sustainability and evaluation planning from the earliest stages of this work. And so with that, again, I just wanted to put out there, when we think about this work and we're thinking about transformation, there's this real opportunity to think about what kinds of partnerships we envision. Well, what is our vision? What kind of partnerships do we envision? What is our approach? Is it evidence-based? Is it innovative? Is it programming? Is it policy? All of those are completely appropriate as long as our approaches are based on data, quantitative and qualitative data that take into consideration the context of the community, what type of impact we want to see, and then how do we think about sustainability. So those are core elements of what we think about as it relates to collective impact and community transformation. And then finally, Judi, I just wanted to go and ask this last question, if you could develop a collective impact model, what would you want to gain? So if you think about developing a collective impact model, if you want to go there, what do you want to gain? And what we'd ask is choose as many as apply. Do you want to see greater impact in a particular topical area or particular priority or target population? Do you want to see more aligned strategic efforts? Do you want to see the prestige of collaboration and working with others towards the same goal? Do you want to see a faster pace towards change? So let's see what you have.
We've gotten several questions in from the audience, but I'll
sure.
Ask.
Okay.
But I'll also plant the seed because one of them was motivation for being part of this and sharing the credit.
Okay. We'll get to that. Do you want me to answer that now, or do you want to look at the data?
Sure. Why don't you go ahead and answer?
So motivation, give me a little bit more.
So how do you engage people in this? What is somebody's motivation, or how would you entice them to come to the table when they might not see this as benefiting or being part of their agenda?
Well, I think that's a critical piece to collective impact work and collective change work. I mean, the reality may be is they will never see it's part of their work, and I think you need to accept that. And so part of the discussion would be is that if you have a critical mass of folks that don't see this as their work, I think then you need to look at whether we're doing the right thing, whether we're focusing on the right thing. If it's just a few people, then I would say maybe give them the space to go off and do what they need to do. my experience has been, and probably I'd love to hear your thoughts, Judi, is that my experience has been that when people are interested in moving the needle on something like that example in Vermont, I think you can quickly develop a critical mass of folks who are motivated and engaged, and in many instances aren't even looking at compensation for this. They're looking at doing this because it's for the greater good of a larger group of people or the community. So part of that is beginning to tap into, one is, what are the issues? What's the data telling us? What's the context in the community qualitatively that's leading to these issues? And then where are people? Where are they interested at? What do they want to work on? What are they interested in working on? A lot of times this is predetermined by a funding source, whether it's coming in from the outside or it's internal. In the best case scenarios, there are opportunities to do this kind of collective thinking and collective assessment and data gathering and planning that allow people to kind of then chart a course based on what the providers and the community members are thinking about. So I think motivation is getting a better sense to know who your audience is or what they see as the issues. And in addition to what they see as the issues, what are their capacities and what's the readiness to address these issues to move forward?
Thanks, Steve. I'm going to share the results that we got.
Sure.
Majority of folks. Around 50% said that they were looking for greater impact on their particular topic or target audience.
Wonderful.
38% are looking to align their efforts, and about 13% were looking at a faster change of pace.
Great.
Certainly, collective impact is not something for a speedy solution.
Nope, it's not. But I think when we think about collective impact, you begin to build the foundation that allows you to move towards that social change. Interestingly enough, that it doesn't surprise me that people want to see greater impact on either a topical area or a particular audience. This may be coming from them as participants, which I would think is a big piece of this. Sometimes it's also coming from the funder. I tend to like it when it's coming from the community or the participants, because then it's really internally being driven. And my sense is that if we want to gain this greater level of impact, my thoughts out there is, so how, what do we want? What are our expectations around impact? What do we want to impact? Who do we want to impact? And what do we want to see? And then the clearer you are with beginning to answer those questions, it gives you a chance to begin thinking about what kind of approaches do you want to formulate that will lead to that level of impact, whether it's on a topical area or a particular audience.
And the clearer you are with that vision at the beginning.
Exactly. And as you think about that vision, it can be broad. It could be very broad around, healthy communities or healthy opportunities for all. But what does that mean then? Where are you going to start? Where are you going to start the work in terms of around impact? So what's the topic, or what are the topics? It doesn't have to be just one topic, but it could be a comprehensive piece. And who are your audiences that you want to look at and work with? And my hope is that those audiences are involved in the conversation from the earliest stages, going back to the visioning piece. And then more alignment of strategic efforts. That's no surprise to me that that's high up there too, because I think what we are finding is we do kidney health improvement work across the country. There are a lot of great things that are happening, and there's an opportunity to coordinate these efforts more. There's an opportunity to align these efforts more. So the very nature of bringing together more of these partners under this collective impact approach allows us to have a greater understanding and discussion about what efforts are happening. Too many times I'm in community, either working with community members or providers who say, I didn't know that resource existed, or I didn't know that was there. So in some instances it may be intentional, but in many instances people just don't know and it's unintentional. And so this is an opportunity to align and coordinate resources.
Great.
Is there another question?
There is another question. One of them was, can you distinguish the difference between the tasks for the backbone organization versus the chair of a leadership team? And could they be one and the same?
Well, I've known some backbone organizations that do chair a leadership team. And I think that's great, because you've then got the dedicated staff who can move that agenda along. I also know some collective efforts where that person who serves in the backbone role does not coordinate or does not lead those efforts, but he or she is, in this particular case, this woman is coordinating those efforts. So she's part of the team, but she's not necessarily the chair or the co-chair. So in this particular case, we have one chair, a co-chair that's a provider, another co-chair that's a community member, and the person from the backbone organization is kind of the convener and the facilitator, but they're not necessarily formally leading the work of the collaborative.
Thanks. There was another question about wondering if you would suggest having partners sign on to commitments.
Oh, great question. This varies across the spectrum. Some groups we work with say they don't want to get into MOUs or memos of understanding. And again, if that's the persuasion of the group, that is fine. I tend to find that when you do have some kind of a memo of understanding, it's helpful to know what you're buying into. And it helps begin to clarify roles and responsibilities. These are not binding commitments. I think sometimes we may think of them as binding commitments, almost like a contract. So I think of it as a contract as a lowercase c as opposed to a binding contract. When you have a good MOU, what this does is it allows folks to really begin to think about what is their role and what is their level of responsibility in this work. And those MOUs, in one group I'm working with in Rhode Island, members from the collaborative develop what that template would look like. And depending upon where you're at in terms of your level of engagement, there's a little bit of a distinction between serving on a leadership team or a steering committee versus a working group versus being a community member. And it's nice when those things are in existence because I think it helps to formalize what the relationship and what the agreements are. And I think part of what's also nice about this is when people begin to leave to move on to other work, as in this coalition, they've got quite a few people who've served quite a bit of time there who are now moving on. This creates a level of history and context in terms of involvement of these entities over the years. Again, I'm not suggesting it has to be done. There are other very high-functioning collaboratives and collective efforts that don't necessarily have MOUs. I think it's what people are comfortable with. At the very least, though, what I would emphasize is that people are clear that there's some kind of a structure of the entity, going back to a question that was asked earlier, and people are clear about what that structure looks like, how decisions are made, and what the roles and responsibilities are of members and how work gets done. If that's not articulated, I think it gets very confusing quickly. People tend to drop out, and there's greater opportunities for conflict, not about the content, but more about the processes and the structure.
Yeah. And I was just going to add that I think those commitments are helpful if they provide greater clarity and if they help with the trust issue, because
Absolutely.
That really can't be emphasized enough. If you want people to stay at the table, then they need to understand what their role is.
Absolutely.
And what they can count on others for as well.
Absolutely. And that's another nice piece about the MOU is that people know what everyone else is committing to.
Right. There was a question about methods for tracking processes as well as the products.
Mm-hmm. Oh, that's a great question. So what methods are used to track the process and the product, indicators, tools, and systems? So for that person, I'd be happy to talk to you a little bit more in depth. We are currently working on a project with the Centers for Disease Control and Prevention where we're looking at a whole tracking system around the outcomes related to the work. And Judi and I have been working on another this project where we're looking at indicators related to process. And so when we think about this, what's exciting around tracking some of those process pieces, it's everything from people in terms of thinking about who's engaged, how they're engaged, and to get a context of that. It's around governance. Is there kind of an organizational structure? Are there roles and responsibilities? Are there job descriptions? Are there MOUs? So there are things that you can track around governance and structure. There are things that you can track around processes related to communications in terms of whether there's internal communication planning. Are there decision-making processes and bylaws that are clear? How are decisions arrived at? Is there an external communications or marketing plan? There are processes related to sustainability in terms of do you have benchmarks or outcomes related to how much you're interested in raising, where are those resources coming from, what's your track record or success in terms of actually being able to secure private philanthropic dollars, federal dollars, dollars from corporations or from contributions. So thinking about your funding streams and how you're setting benchmarks in each of those areas or metrics, and then what kinds of processes are you following. There's also processes around simply champions in terms of being able to identify, so how many champions do you have who may not be part of the process, but is there an opportunity that you can call on 5 or 10 people as champions who support the work that you're doing, who have access either to resources or political will or capital to support you in your efforts, but these people may not be involved in the day-to-day workings of the collaborative. So we're happy to share some of those tools, or maybe we'll send those out to all of you so you can have them.
Thanks, Steve. And there was a couple other questions. One around examples, and I know that the Collective Impact FSG site has a forum, and there's over 10,000 members in that forum.
So I think if people go to www.fsg.org, there is a Collective Impact forum where you could learn about some of the things that are happening through that forum. I would say, I'm just thinking, a lot of the things I know about are things that are either happening at the regional level or municipal level. I do think there are things where you're beginning to see kind of collective impact, like with the National Convergence Partnership, which you can Google, which is managed through PolicyLink out of the Bay Area and Prevention Institute. That's bringing together a group of funders and the Centers for Disease Control and Prevention to look at initially issues around food access to now beginning to address the issues of equity. So to me, that's kind of a group of folks coming together collectively to think about impact around resource investment. You may also look at, I think FSG is the best site, but I'm also thinking CDC through its Community Health Improvement Navigator. As they begin to gather data across the country about who's doing this work, there may be a place there through cdc.gov/community Health Improvement Navigator, or you can just Google Community Health Improvement Navigator. You might find some things there that are happening also at the kind of local and regional level. I know the American Heart Association is beginning to explore things like this as well. So those are a few examples.
Great. Thanks very much.
Sure.
There was a question about the Vermont experience that you had, wanting to know if you actually had elders involved in that planning.
Oh, good question. We did. In fact, all of the planning, it started with elders, and it basically, the core group was elders. And they range from, I got to be careful what I say here. Let me just say older adults, anything from 60 all the way up to 98. And I'm saying that because as I enter into that span myself, into that age frame. But the oldest person we had gathering qualitative data was a 98-year-old woman who basically felt like she could not add anything to the conversation except her experience. We did a training of trainers and got her to be trained as a focus group facilitator, and actually saw one of the best focus group facilitations I've ever seen from a woman who had not only the experience but the empathy to draw out information from peers. So yes, the core group of folks there were elders. And quite honestly, this was their vision, working with the gentleman who became the ED of the backbone organization Valley Cares from the very beginning. And this vision came out of a bit of a frustration about what are we going to do now that this facility is closing, and how do we make sure we age in place. So in the beginning, there was a lot of tension and there was a lot of friction. I don't want to make it sound like it all was smooth, but very quickly people organized and decided to kind of coalesce around some real positive visioning and positive social change that got the attention not only of key players in the community, but also across the state, and then this funder, this private philanthropic funder.
Great. There's a slogan that I've heard recently that I really like, and it's called "Nothing About Us Without Us." So I think it really points to the issue of equity and
yes.
inclusion. And if you have a target population, like in this case it was the elders, that
yes.
they're a necessary ingredient.
Absolutely. Absolutely. And their message was to us, we've lived here for all our lives. We've lived here in these homes for generations. We realize we may not be able to age in place in our own home, but we certainly want to age in place in our community. We don't want to be, even though across the river is not that far, we don't want to be in another community. Talk about issues of isolation and loneliness. Here's a space now where they're in their community, folks are in their community, and they're with their peers and in some instances their neighbors.
Great. So I guess we're at the question stage. There was one other question too about if somebody is about to embark on this or thinking about collective impact for the future, what kind of trainings might we suggest that they
around this idea of moving towards collective impact? That's a great question. I would look at like the FSG site and get on their collective impact forum to see what types of webinars they're offering. I'd also say feel free to look at what we offer through the Training Institute. There are some things that we're going to be offering beginning in September through this series of webinars about building capacity to move a collective agenda. And so we'll be looking at some of the things I kind of walked over at like the 30,000-foot level. We'll be spending each month going deeper into some of these areas, doing deeper dives. I'd also look at the Policy Link website. I'd look at the Prevention Institute website. I'd look at the CDC Community Health Improvement Navigator website. I'd also look at the Association for Community Health Improvement website. ACHI, as it's known, has a healthy communities effort with all the nonprofit hospitals. And in fact, they're doing a great training next week about how hospitals can get involved in community health improvement efforts. I think it's next week or the following week, but it's another great resource. So if you just Google Association for Community Health Improvement, you'll quickly see their website. And we can send some of these websites out to folks on this link.
Terrific. I wanted to mention to folks that as we're winding down with questions, that we will send the link to this webinar recording out. We can also attach the slides and resources. There were a few questions about specific resources that Steve had mentioned, like the membership PDF and so forth. And if you contact us individually, we can send those to you in another format if necessary.
And I'm also thinking maybe Judi and Stephanie, if it's possible, we could send out a few of these things to the whole group.
Absolutely.
As templates. And feel free to use them. We just ask if you remember, give us credit, but feel free to use them, and we hope they're helpful. And if you have adaptations to these tools, let us know, because that's what we also appreciate is when people are using these and adapting these to their own community context. It's helpful for us to see that.
Great. Great. Well, thank you very much. And Steve, I appreciate your insights and your learning. And as I said, we'll be getting this information out. You can stay in contact with us. We also have a LinkedIn group and a Twitter group, and happy to have people join us on future webinars. And as you said, you can take a look at our calendar online and join us. The new calendar should be up at the beginning of August at the latest, if not late July. And thank you for joining us today. I have one more comment. Yes, go ahead.
Sure. I wanted to say, Judi and Stephanie, again, thank you for the work you've done putting this together with your vision and your capabilities to do this. And to the group that's participating today, thank you for all the work you're doing in community. And I've got to tell you, this is an exciting time to be part of this process. There's another resource I feel like we could send to you that looks at how hospitals, health departments, and others are looking at these community health improvement efforts. And I'd really encourage you to look at what are hospitals, health departments, health centers, community action agencies doing in these areas, because there's an opportunity, if you're not already connected to them, to connect to them as they do their assessment and planning. And our hope is we envision a day when there are a lot of communities like San Antonio where everyone's coming together to do a collective assessment and a collective planning process that really frees up the resources to do the implementation piece and move towards collective impact and community transformation. So thanks all for your great efforts. It's been a pleasure.
Yeah, and I wish you well. I also say keep your eyes out, because I think some of the funders are also starting to invest in this planning process and investing resources and the ability for people to do that community engagement membership, and establishing backbone organizations too. So thank you very much. I'm going to sign off, and you'll be getting emails from us, but feel free to contact us with further questions or need for resources. Thank you.